in this session, I plan to try and inculcate the virtues of cord blood banking, the importance of stem cells and stem cell therapies, and in what way it could be associated with the daily and routinely important health and well-being of a person. Next slide. Before we get into the thick of things and take a deep dive, it was important for me to just speak about what ReeLabs does. And ReeLabs is considered Asia's premier integrated stem cell company. We have a large facility in Asia, the largest one in Asia, in fact, spanning over 50,000 square feet of space. Uh, Personally, I have been a keynote speaker in numerous conferences worldwide. We have over 250 employees, 30 to 40 doctors and luminaries from various fields, 250 publications in PubMed index journals, 5 patents, all of them granted. And one of the latest claim to fame was we were involved in India's first and only stem cell based clinical trial to treat COVID-19. We did that in Sion Hospital, and we treated the moderate to severe COVID, not the patients on ventilator. And the results were extremely positive, very noteworthy. Most of the patients got discharged. And also the trial data has been published in a journal which is considered the big daddy of stem cell medicine, that is American Journal of Stem Cells. I've also authored 2 chapters in textbooks for postgraduate students. And currently there are 3 ongoing trials for critical limb ischemia or diabetic foot, also smoker's lung, which is quite rampant, and liver cirrhosis. So they are all important disorders. And going by the virtue of our title, that is World Cord Blood Banking Day, stem cells from any of these sources have a very, very big role in the health and well-being of a patient. Before we get into the importance of only cord blood and the stem cells derived from cord blood, let's have a very basic overview on stem cells. What are stem cells? There are plenty of definitions floating around. The definition that appeals to me the most are these are very young, naive, unspecialized cells, but which have an amazing power to transform into any tissue or organ in your body. And to make it simple, stem cells can basically give rise to any cell, organ, or tissue of your body. And to make it simpler, in case it can do that, it is obviously associated with the repair of any cell, tissue, or organ of your body. So basically, stem cells can give rise to liver, it can give rise to muscle, it can give rise to WBCs, RBCs, cartilage, bones, fat, nerves, and all these in some form are associated with, a combination of these are in some form associated with the body that we all carry, and hence stem cells have a very important role in not only firstly giving rise to these organs, but also maintaining the health, optimum health and vitality of these organs. What are the sources of stem cells? There are plenty of sources, some of them being adult, some of them being at the time of childbirth or delivery. The ones at the time of childbirth are on the extreme left, which are the cord blood, cord tissue, placenta, amniotic sac, amniotic fluid. And then the one on the right are the adult stem cells, which are basically stem cells derived from adult sources. So like something like a dental pulp, menstrual blood, adipose tissue or fat, bone marrow, hair follicles. All of them have a very, very important role in as a source of stem cells. Just to reiterate, the ones that are available at the time of childbirth are cord tissue, cord blood, amniotic sac, amniotic fluid, placenta, etc. All of them are wonderful sources of stem cells. And in fact, placenta, as a matter of fact, has got the kind of stem cells or the characteristics of stem cells from all sources. So it's considered one of the finest in terms of quality and quantity. Now let's come back to the topic of today, which is a World Cord Blood Banking Day. And what is the history and significance? Typically, there are plenty of days floating around. Like, for instance, the 4th of March is the World Cancer Day. The 14th of November, that was yesterday, was the World Diabetes Day. I think 2nd of February, if I'm not mistaken, is the World TB Day. So whenever any health authorities, uh, firstly, any authorities, second, health authorities, and thirdly, the most important health authorities like the UNESCO or the WHO or the UN, any of these authorities which are in any form associated with health and well-being of a patient, of a person, consider any condition or any product or any activity significant to label a day uh, to mark its significance. uh, we can immediately figure out how important that activity, the product, or the condition is. Now, in this case, cord blood was underestimated for quite some time, but it's high time we wake up and smell the coffee. It is now considered one of the richest sources of stem cells in terms of quality and quantity. Also, the importance of cord blood lies in the fact that this is a one-time opportunity. In case the delivery happens and the cord blood, for whatever reason, unfortunately, is not collected, there is no second chance unless there's a second pregnancy. So, given the importance of cord blood and the stem cells associated with it in maintaining the health and vitality of a person and also mitigating most disorders. Okay, and when I'm saying most, I'm not talking about something on a very loose basis. It's not a loosely made statement. It is a statement based on the fact that there are many disorders that have got no treatments. There have been many disorders where there is no comprehensive work happening in research, and many disorders that researchers and doctors like me classified as no hope disorders, especially neurogenic disorders like your Alzheimer's, Parkinson's, cerebral palsy, autism, etc. So, to the advent of stem cells, especially from the cord blood, we've all been given a renewed lease of life. We've seen what it can do, and the fact of the matter is, going by its rushes, uh, it's inevitable that with time, the stem cells from cord blood will have a very, very rich place in the future of clinical medicine. Going back a little bit, uh, the first stem cell bank, rather the first cord blood collection, was made in 1978, if I'm not mistaken, and the first successful transplant using cord blood happened in 1988. Uh, After that, there have been plenty of cord blood banks all over the world that have sprouted up, and most of these cord blood banks have also, entrusted with some form of therapy. And the latest that I hear is that about almost 40,000 successful cord blood transplants have taken place. So it's a very, very important field of medicine. It's a very, very significant milestone in the field of medicine. And that is the sole purpose why the regulatory authorities or the health authorities felt it was imperative to label a day, that is today, as the World Cord Blood Banking Day. So what is cord blood? Cord blood is the blood that remains in the placenta and umbilical cord after the birth of a baby. Uh, it is very rich in stem cells. Of course, most of the stem cells which are found in cord blood are hematopoietic of nature. And when you talk about hematopoietic in nature, we're talking about stem cells that can give rise to blood and blood forming tissues. So all your WBCs, RBCs, platelets, most of your bone marrow constituents are all derivatives of cord blood derived stem cells. And recently, it's also used to treat many different cancers, immune deficiency, genetic disorders. And trust me, most of us would, in some form, have an application in times to come using cord blood stem cells. Uh, Again, to uncomplicate the whole process, uh, how is it collected? Of course, most of you may have seen it, heard it, spoken about it with your friends and peers. But just to recap, it's collected right after birth. It is absolutely painless. So there's no pain whatsoever for the baby or the mother. And most importantly, it is safe. There are no health hazards. There are no issues that can occur at the time of collection, and it is so quick and painless. And it happened with me also during both my babies. That while the baby was born and I was just bonding with the babies, the paramedic had finished the process of cord blood collection and left the OT. So it was so quick that we didn't even realize when it happened. However, it is imperative to note that in case it could have been missed out, it could have been a mistake of a lifetime of sorts. So it's a good idea to understand. It's very safe, painless, and a very quick process with no hazards whatsoever to the mother and the baby. After the baby is born and the cord is clamped and the baby is separated, that is when this process starts. So there's no question of a needle prick or any kind of injury to the baby at the time of delivery, because the whole process starts only after the baby is delivered. Once that is done, there's a needle that is inserted, assuming we use bags, and that's what we use. There's a needle which is connected to the bag, is inserted in the cord, uh, umbilical vein, which is a part of the umbilical cord, and about 50 to 100 cc's, depending on the extent of blood available in the placenta, is collected. Once that is done, it has to be sent in sterile, hygienic, and the correct process to maintain the cold chain in the cord blood bank that is with us. And once it reaches us, we immediately process it and store it in a cryo container for long term. The long term can range from 20 years to 80 years. Of course, it can be even kept for longer than that. But currently, since a typical lifespan is considered 75 to 80 years, the maximum tenure of storing or preserving these cells is about 75 years that we consider. As mentioned before, it has been used successfully in treating many disorders, and over 40,000 cord blood units have already been used in the last 20-25 years. Most doctors have stood up and taken notice of this very important facet of clinical medicine. And as they say, necessity is the mother of all invention. When we realized that when we doctors realized there was no treatments available, we started looking around for various treatment options that could have been extracted from what we had. And that is when the importance of cord blood, the importance of cord blood collection, the importance of stem cell preservation came in. And at this point in time, all of us have now stood up and taken notice of the fact that most disorders that could not be treated earlier with any conventional therapies can now be treated with stem cells from the cord blood, cord tissue, or the placenta. So it's got a very, very huge significance in clinical medicine. Again, that justifies the fact that it deserves a day marked for its significance in health and well-being. That is the 15th of November, that's today. Cord blood per se is used not only for the child, but also for the immediate family, can be used for people whose HLA samples can be matched. And curiously or uncannily, we've noticed that the stem cells from cord blood, they match beautifully with parents and grandparents especially. So it's a nice way of giving back to grandparents, because grandparents keep giving everything possible to their children and especially grandchildren. So it's a lovely payback, because at that age, most grandparents would have some kind of an illness of sorts. So if the child's cord blood can be used to mitigate or cure any of the illnesses, it's a wonderful way of returning the favor of sorts. This is the picture of ReeLabs. We'll be happy in case anybody was interested in coming and visiting, obviously with prior appointments, so that you all understand an important facet of medicine, which is now evolved and has now been socially and medically accepted. It's available, so it's important that we take notice of this extremely vital field of medicine, that is cord blood derived stem cells, and look to apply it in various fields of health and medicine. So that concludes the very short presentation. Of course, we are happy to take questions, because this is considered to be more of an interactive session. So any questions that any of you have, kindly feel free to ask.
Thank you so much, Dr. Abhijit, for all the insights regarding cord blood banking. And there are some questions which are in the chat box. So if you could just get to them, please.
Okay. I'll go one by one. So I can see the first question, which is related to, I think, the legalities. Are these legal to preserve as per ICMR? And preservation is banned, only corporate is allowed. Uh, okay. Uh, I don't know who's asked this question, but it's a wonderful question, and I'm happy this question was asked at the very beginning of this session. Uh, First of all, ICMR is not a regulatory body. ICMR is not even a governing body. It's a body that will that provides information, that provides. It's the Indian Council of Medical Research that is associated with research. The license for cord blood is given by the DCGI, that is the Drug Controller General of India, and the FDA, that is Food Drug Administration. Uh, at this point in time, the licenses that are available for this field is only for cord blood. So, and in fact, today is the World Cord Blood Day. So, with respect to the World Cord Blood Day, and in keeping with the spirit of the Cord Blood Day, the licenses at this point in time from the regulators are only available for cord blood. All other tissues, whether it's placenta, uh, the cord tissue, or adult tissue, uh, there are no licenses which are available from the regulator, but there are permissions that need to be taken. Now, for instance, in case I talk about ReeLabs per se, we have an official permission to bank placenta and many other tissues, especially because we are looking into doing clinical trials. It's very simple to make it very simple. Whenever you're doing any trials, whenever you're doing any activities which is involved in research and therapy, the first thing that we need to do in the world of stem cells is bank those cells. So without banking it, I can't use those cells in therapies. And since we are doing these trials for critical limb ischemia or diabetic foot, also for liver cirrhosis, also for COVID, which we completed, it was imperative that we banked our cells. And the product that we used for these trials was for placenta. Hence, since we are using our placental product, we had to seek permission, and we got an explicit permission from the regulator to bank these cells. So yes, right now it is the license per se, which is only available for cord blood. For the others, we need to seek permission. Uh, the next question I can see is, can IgA nephropathy be treated? IgA nephropathy is basically immune system disorder. So what happens in immune system disorders? It typically hurts the kidneys the most. In fact, I had a thesis topic on kidney, so I've worked a lot personally on nephropathies, and IgA nephropathies was right at the top of these research topics in kidney. And typically, in IgA nephropathy, what happens is there's proteinuria. There's a lot of protein deposition, because of which over a period of time, the patient goes into chronic renal failure. It's an immune deficiency kind of a disorder. And stem cells have a big role to play. Of course, at this point in time, I'll never stick my neck out and say that it's a bona fide therapy for these things, simply because uh, uh, at this point in time, firstly, we need to complete a trial whenever we're looking to postulate the benefit of any cells in therapy. And stem cells per se have a very important property of immunomodulation. What is immunomodulation is, uh, whenever there's any erratic behavior of your immune system, and IgA nephropathy can be classified as one of those disorders, the easiest treatment is modulating the immune system. Stem cells have a role in modulating the immune system because they have immunomodulatory properties, because of which potentially it's got a role. There are lots of trials happening in IgA nephropathy, especially, and hopefully, in times to come, we should have a concrete cure. Uh, why does ICMR banking? I just spoke about it, so it's pointless talking about it again. But ICMR again is not a governing body. It's more of a research body, and they have again, I mean, the licenses are available for cord blood. For others, you need to take permission. Without permission, it's never a good idea to do anything. And especially with so much you can say bad mouthing. There's so much rumors floating around with respect to sources and kinds of stem cells. It's a good idea to always do the right things, and that's what I personally believe in too. Uh, what if one wants to do a delayed cord blood clamping? This is a lovely question, Gauri. And I'm glad I asked. I would have liked to speak about it during the presentation, but somehow, it slipped my mind. Delayed cord blood banking, in fact, is a very important activity at the time of stem cell collection. In fact, there is a lot of anguish amongst expectant parents, about missing out on the nutrition and the health of the baby, because all the blood was used for cord blood collection. And when that happens, what is most important is at the time of delivery, the baby is most important. And should anybody compromise with the health and well-being of the baby? Answer is a big no, a resounding no. So I support delayed cord blood banking. But Gauri, if you could just, if you remember, at the time of the presentation, I mentioned that cord blood is basically the blood that is remaining in the blood in the placenta. And I go one step further. It's a good idea to push out every bit of blood back into the baby before clamping the cord. And only once that is done and the baby is separated, and basically you're in a position where the rest of the material is biological waste, that is when I advocate cord blood collection. The reason is, firstly, cord blood, even that quantity, a very small quantity also is good enough. Secondly, there is something called in vitro amplification of stem cells, which we personally do, where in case the quantity in terms of quality or quantity isn't sufficient to facilitate a successful transplant, there is an option of amplifying the stem cells or increasing the number and the quality, and bringing it to a level that is adequate to facilitate the transplant. So it's a good idea to do delayed cord blood banking. ReeLabs, me personally, I support it wholeheartedly. My sole contention is look into collection of the biological material after all the cord blood that can be pushed back into the baby is facilitated and the baby is separated. And whatever remains are there is also a good enough product in terms of quality and quantity in terms of cord blood banking. The next question I can see is, if DNA of the baby and cord blood is the same, the cord blood will have the same defect as that of the baby. What is the percentage? Yes, that's absolutely correct, Snehal. In case there is a problem with the DNA and the mutation, for instance, I'll personally give an example of say leukemia. So in case the patient, unfortunately this child has leukemia at a very young age. So effectively, what you're trying to ask me is, wouldn't the stem cell sample that has been kept for the baby also be defective and will not be able to successfully facilitate a stem cell transplant to cure the baby? Answer is partly yes, partly no. For which we'll have to now just take a deep dive into what happens in leukemia. In leukemia, to make it simple, it basically your blood cells, they turn malignant. They start proliferating out of control. That is what cancer is, and that is why it is one of the worst blood cancers possible. Uh, the only treatment available for conditions like these is that you need to completely irradiate the bone marrow, destroy the original bone marrow, look out for a match, and once you get a successful match, replace the bone marrow with a new bone marrow or a new cord blood sample that can change the bone marrow completely and cure the patient's condition. So there are two or three parameters here, Snehal. Number one is that we need a successful match. And trust me, in this day and age, and I'm talking about my personal experience in most stem cell registries, the biggest challenge most doctors face is finding a match. Uh, when that is a problem, and while you're hunting for it, if the patient deteriorates and we don't have enough time to play with, so what are the options? That is when the importance of cord blood collection comes in. During any leukemia, there are phases of remission and relapse. Remission is basically when there are when there is no when there's no leukemia, when clinically the patient is safe and sound after whatever cycles of chemotherapy, radiotherapies, or immunotherapies have been facilitated or instituted. And relapse is when the cancer comes back, hook, line, and sinker. So what we're looking to do is enhancing the period of remission. And if we can do that using your own match, uh, just look at it this way. I mean, if I can be slightly crude here, supposing the patient gets leukemia at the age of 6 years, okay, and here we have stored the cord blood again. Let's not quote this as an example only, but just to make it simple. Supposing we've stored the cord blood, which is day zero. So typically in remission, if we use the same sample, it definitely means that we have a lot of time, maybe 6 years, up to 6 years to play with, to find a match that can give rise to a complete cure. So those 6 years at that time for a person of leukemia, I mean, again, I'm giving an example of 6 years. It could be 15 years, 20 years, 30 years. Gives the most important factor to cure a patient of cancer, and that is time. So I hope that answers your question. Is it true that one collection is insufficient? It depends on exactly what you're looking to do. There are plenty of disorders that require many more stem cells than what one cord blood unit can provide. So it's important that you, after you've banked your cord blood, you make the certificate of analysis, or the COA as they call it, as your best friend. Talk to your doctor that this is what my baby's cord blood says, the certificate of analysis says. Check with us if you want, because this is something that we've worked with over a period of time. Whether the COA mentions the cord blood collection and the quantity and quality of stem cells uh, as optimum to facilitate a transplant. If not, let me tell you, firstly, again, since it's a process, in case the paramedic or for whatever reason, cannot collect adequate blood, because see, eventually it's like whatever number of blood you collect, whatever amount of blood you collect is the first criteria in getting a healthy count. And a lot of times, even if I would like to say a lot of things, I dish out all SOPs and all. At the time of delivery, there are things that happen that are beyond anybody's control. So it's very difficult to, control exactly how much quantity of blood you're looking to collect. And however, if that happens, I already mentioned that there's something called in vitro amplification or in vitro expansion of cells, where the uh, the stem cells that are collected can be amplified in the lab, and we do that. And that is one of our proprietary technology. We do that, and we bring it to a quantity, or and we store in vials, which is adequate to facilitate, at least one of the most known disorders. Of course, going forward, there'll be many more disorders coming up, but for most of the more known disorders, we try and keep an adequate count. So if and when it's required, God forbid, we have adequate material to play with to facilitate a successful transplant. Uh, okay, Dr. Sujit is talking about what are the different ailments which can be treated with dental stem cells. Is there any unique features? Yes, dental stem cells and stem cells harvested from the dental pulp is something that's coming up in a very, very big way. And stem cells from the dental pulp especially have a neurogenic potential, which means it can give rise to nerves and any neuro disorder or neurodegenerative disorder. So if I can just classify a few, whether it's Alzheimer's, it's Parkinson's, cerebral palsy, autism, uh, also multiple sclerosis, stroke, spinal cord injury, all these are classified by doctors like us, and even neurologists all across the world as no hope disorders, because there's no treatment available for disorders like these. It's only about giving symptomatic treatment and just looking to manage the quality of life, rather than looking to get into any curative or any comprehensive treatment module. That is when stem cells from dental pulp have a big role. A lot of research has happened, lots of publications on dental pulp stem cells, where it can give rise to nerves, it can give rise to neural tissue, which obviously would have a big role to play in reversing neurodegenerative conditions. Uh, okay, iPhone to everyone, community banking versus cord blood banking. I love this question, and I'm glad somebody asked me. Firstly, I can go on and on about community banking. And while the concept is an excellent concept, I wish more is done. But currently, the way it is implemented or the way it's executed is nothing but a big sham. And because of which I will abhor, I'll detest the very concept of community banking. And I'll give you my reasons for that. Number one, for a community banking to be a successful venture, you need to have a community, as the word says. I mean, it's a part of the word community banking. Community is the most important word. And community in the world of stem cells is minimum million samples. Okay, a few thousands don't form a community. And why a million samples? Because the cord blood or the stem cells from cord blood or cord tissue or placenta, they express something called HLA, which is the genetic uh, constitution of a person, and which looks after the immune system of the person. And there are six kinds of HLAs, which is HLA ABC and HLA DP, DQ, DR. For a successful match, minimum 3 by 6 or 4 by 6 of a match should happen. And even in NetCord, which have millions and millions of cord blood samples with their HLAs, uh, it's extremely, extremely difficult, in fact, close to impossible to find a successful match. Uh, Simply because if you're looking at community banking, firstly, you need to have a big community which apart from NetCord, which is the global stem cell registry, nobody else has such a big community. Secondly, assuming we bypass that hurdle and we get into the community, we need to do a HLA of each and every sample. So even if there are a few thousands or lakhs of samples with a particular cord blood bank, I need to do the HLA of each and every sample and post that HLA to everybody. An HLA test. I mean, I'm also a pathologist. I'm also a blood banker. I have multiple a chain of labs and blood banks all across Mumbai. I'm into this field personally. An HLA with all the cost subsidies would be a few thousand rupees minimum to get the test done. And if a cord blood bank is actually doing it, you're looking at investing a few thousands into lakhs of samples. So you can imagine the quantum of revenue that will have to be pumped in to to have a proper community with HLAs of all the samples done, which also is next to impossible because that company will go belly up. So that too is not possible, which means if the HLA is not done, the whole concept of community banking itself is tossed out. And thirdly, once we look at community banking, it means that you have given away a sample to the community. You don't have as much control over that sample because now you have leased it or licensed it to the community. Anybody can look into taking a sample, or you can take anybody else's sample. Uh, if I look at it commercially, which is not something I like doing, but anybody who can just Google online and see what the cost of each stem cell sample can be. It goes in millions of dollars, especially for very lethal conditions like leukemias, multiple myelomas, etc. So, when you talk about private banking, I mean, if I look at it from my point of view and in a holistic manner, if I have banked somebody's samples and there's money that is collected for that sample, it belongs to that person. So if I have banked, say, Dr. Gauri Patil's sample, that sample belongs to her for whatever tenure she has signed up for. Nobody else except Dr. Gauri Patil should have right on that sample. And in case tomorrow, if Dr. Gauri Patil deems fit that she would like to post it on Netcord and auction it for millions of dollars, that is her Sam. It's her own investment. Let her do what she wants with it. Nobody has to have any control over it. Unfortunately, with community banking, it's just the opposite. That you allow the community to take charge of it, and even the commercial aspect that a person can potentially make has also been tossed out. So, all in all, the whole concept of community banking is excellent, but if done correctly, appropriately, and pragmatically, which in this day and age is almost impossible. If not, it's not almost. It's impossible to fulfill. Hence, I do not advocate community banking unless it's done correctly. Uh, okay, I see a question. If a mother has thalassemia trait and father doesn't have, will the stem cells be useful? Answer is a big yes. simply because what happens is typically thalassemia major happens when two minors get married and they have a baby, and they have a 25% chance. A thalassemia trait and a father who doesn't have thalassemia trait or thalassemia major will most probably have at most a thalassemia trait baby. So there is no problem with the cord blood. There'll be no problem with the the quality and quantity of stem cells. And if at all, it'll only benefit the child going forward. Dr. Vijaya Kurup, is stem cell therapy a continuous process, especially for degenerative and lifestyle disorders? By that I mean, do you need long-term therapy with multiple sessions? Dr. Vijaya, it depends from case to case. It depends from condition to condition. Because when I started my session, I mentioned that stem cells are here to stay. It's high time we wake up and smell the coffee, and necessity is the mother of all inventions. So stem cells have a big role to play in very uh, minor lifestyle like disorders, like you can say even something like anti-aging and plastic surgeries and breast enhancements, which typically are not life-threatening, but it's more of a lifestyle, more of a cosmetic disorder. And on the other end of the spectrum, we are talking about diabetes, diabetic foot. We're talking about Alzheimer's, Parkinson's, which are no hope disorders. In fact, diabetic foot, you need to, look at amputation of the limb, and the kind of therapy we are advocating is limb salvaging. So it depends on basically the condition you're looking to treat, and also the kind of outcome you desire. If the outcome you desire is absolutely curative and you're looking at treating a very, very lethal condition, then it it may mimic something like a chemotherapy or radiotherapy, where you need multiple sessions and plenty of cells over a period of time to get a successful outcome, which is desirable. But something which could be, I mean, I won't call it frivolous because nothing is frivolous, but something like a hair loss, maybe something like breast enhancement, which is all, some anti-aging, which a lot of dermats are looking into using stem cells. Then a couple of sessions of very small quantity of stem cells will also be able to give us a desired outcome. And I think most of the queries are answered. In case there's anything else. Okay, there's a question in case it has been already banked once. Uh, should it be banked for the second child? Answer is yes. In fact, if you just read up, just a couple of days back, there's been a case where the elder child had thalassemia major and needed a match. So obviously, the best chance of finding a match was uh, a sibling. So they took a chance, and they the parents they looked into the second pregnancy, gave rise to I mean, there was a baby that was born, the stem cell was collected, preserved, and that's been used to treat the older baby and cure the thalassemia major. In fact, there's some work we've done on autism long back, where the second child's stem cells were used to treat the first child's autism, and the child who was initially going to a special school started going to a regular school after terrific improvements. That's also been published. I hope I've completed most of the queries. If there's something that's missed out, uh, I would uh, I would request the MC to just bring it to my notice.
No, doctor, everything has been covered. Thank you so much. I'm so grateful for your time, and I'm sure everybody must be feeling the same, that their questions were answered in such detail. And I would request everybody in case they wish to participate in the lucky draw, which is a free cord blood banking, kindly leave your name and contact number in the chat box. All other details on how to contact us in case you would like another consultation with Dr. Abhijit, you can contact us using the details that have been left in the chat box. Once again, thank you, Dr. Abhijit, for your valuable time. And we look forward to having another informative session with you really soon. Thank you and good night, everyone. Thank you very much for attending today's webinar. Good night.
Thank you so much and stay blessed.